some of the data we have as an insurance company, and he'll take us through this presentation. From there, we can address any questions we have, and then we go into the celebration part.
If you came here just to do the draw and award, it would have been out of here. It would have been possible. So whenever we get an opportunity like this to meet the media, meet our clients, meet our distributors, we take the opportunity also to try and update you on what's going on in the business in terms of update and where we are going next. So we prepared a short presentation which I'll take you through. Everyone here must be aware now that in January this year we converted to a general insurer, and hence the change of name to Resolution Insurance. We received a license to offer other lines of business, personal accident, workman compensation, liability insurance, medical and miscellaneous classes of general insurance business. You find sometimes we have our senior managers around here, all of them. But I'll ask Abraham is here to stand up. Abraham is our CFO. We have a new addition, Henry, and I saw Betty. Oh, she's eating. Our head of operations. We just met Uni. And as we go along, you'll meet others. These are the people who sit in the head office and are in charge of the operations. Now that we are general insurer, and our vision and a preferred provider of insurance services in Africa, you'll notice there that we dropped medical insurance from our vision and left insurance services. And then whereas before our vision was to conquer East Africa, we believe we've done that. We have extended our visions to Africa, and you'll see on my plan, or when I talk about regional plans, the direction we are going with that. Ahead of the registration this year, we raised our share capital by a rights issue to 300 million. And we had already set up plans to roll out our brand into other markets. In October last year, Resolution Health received a license to convert the business to a general insurer, and we have a subsidiary called Resolution Insurance Tanzania. Early this year in February, we signed an agreement with a company in Uganda called International Air Ambulance, which is the largest HMO, the market leader in Uganda. And we set up a business called IAA Resolution, which is in operation. Newton Derito is the country manager, and they've already started distributing products there. Last week, we signed an agreement in South Sudan with a company called Speed Insurance. It's the second largest insurance company in South Sudan, to set up a brand called Speed Resolution, which will be distributing our products. We're in the process of operationalizing that particular company. We are also in the process of considering options for entry in Burundi. So by the end of this year, we will be in Kenya, Uganda, Tanzania, Sudan, and Burundi, while we consider our entry to other countries going forward. Our mission is to serve our clients, mostly employees, stakeholders, and society, by providing responsive and comprehensive insurance services. Although we become a general insurer, our main business is still medical insurance, and that's a focus we're going to go through. But we want to position our brand as a one-stop shop for medical, one-stop shop for employee benefits. Before, we only used to offer one line of employee benefits, that was medical. We have introduced recently 2 new products targeted at corporates. The 2 products under the new employee benefits category is Work Injury Benefit Act Plus, which is a product that we designed a year ago and we rolled out, and it's growing very well. Then a group personal accident cover. In the next couple of weeks, in the next couple of months, you'll also see the new products which are going to be launched in the employee benefits category. We developed a brand promise for Resolution Insurance, and our brand promise is to be dependable, reliable, and honest in all our engagements in delivery of services. We currently are taking care of over 65,000 members, which comprises of corporate and social groups, families and individuals. Out of this group, about 24% is retail business, which is families and individuals who come and buy services. So our business is still very corporate, although we do intend to grow the retail area. Okay, we have partners with over 500 hospitals in East Africa that provide services for our clients. The difference between us and our competition and how we position ourselves and what our DNA is how we provide services in terms of delivery. And our growth, where we've grown above the industry rate, you must know the industry grows at about 25%. We've been growing at 24% average. That has come because of A, being able to service differently, and second, retention. And clients don't stay with you unless you service them correctly. Our retention rate, which is, I believe, is the highest in the market, is 90%. And we have an internal service excellence program called Customer Mbele that is designed to make sure that in every engagement that we are in everything that we do, the customer is involved there. And there are various initiatives that we use to ensure that the customer is in the center of what we do. So we have dedicated teams that are continuously trained and developed to service our customers. We have our customer contact center, part of which is 24 hours. The 24-hour part handles emergencies and medical calls. But during the day, all calls are received at the contact center. We have relationship managers, and some of them, I think, are in this room, who deal with corporate clients. Every corporate client is assigned an account executive who handles them and acts as a liaison and coordinator when they have issues. Medical care managers who report to the head of operations, and their job is to coordinate and manage delivery of medical services. And then we position all our team members as brand ambassadors to make sure that they can be able to serve our members. We have positioned ourselves to have an open door policy. Of course, it makes work harder for someone like me because they have to be accessible to everybody. It has worked for us. It's not something we're going to change soon. As I see at all engagements, be it social media or my email on phones, calls come directly to me where people feel that they are aggrieved. Or sometimes I get calls that shouldn't come to me in terms of inquiries, but I still have to deal with them because that's how we position our brand. So we position ourselves. We pride ourselves in offering our personalized services with all members. Our sales process, I think right now 50% of our business is sold by our own direct sales force, and the balance of that is done by independent agents and brokers. And even when it is done by independent agents and brokers, we try and make sure that it is as personalized as possible. Okay, we have expanded the providers that we use to above 500 to ensure that a client will find a medical service provider wherever they are. Okay. Whilst in hospital, our clients are visited by our care managers who assess how they are being managed, offers advice, and ensure that the right treatments are being administered. And we ensure that the 24-hour call center is available for urgent medical attention when someone requires it. But from our end, we also try and communicate directly with our providers, with our clients, via SMS, emails, telephone, and other written correspondence. We part of this, some people have been unsubscribing because we wish you happy birthday. We holiday greetings, we give health tips, and reminders for renewals. One of the membership engagement we've had in the last year, and that has worked very well for us, is the Resolution Insurance Kids Club. We started it very small, and now it's become big, where at any time we are taking care of between 1,000 and 1,500 kids below the age of 12 who come with their families to celebrate birthdays with fun and games. We have been doing it in Nairobi, but we're rolling out into the other regions. We're going to Mombasa in August. We have positioned our brand as a happiness brand. We want to position ourselves where our members are happiest. And for that, you're likely to find us in music concerts. You're likely to find us in sports events. Okay, you're likely to find us in art festivals and plays, so that we can be able to engage on a relaxed atmosphere. So many times I'm asked, why aren't you involved in in breast cancer work or other illness-related events. And I say most buying decisions are made when a person is happy. So when we do CSR programs, it's CSR program. But when it comes to actually communicating who we are and try to recruit members, we prefer to do it when our members are happy. We've gone further than instead of offering services when someone is sick, we get involved by working on prevention. So part of our services is we offer free checkups for members where we have negotiated with professionals to meet them and give them advice on subjects related to healthy living. And in addition to this, we offer education meetings with our clients where we actually give them disease trends, we give them health talks, which are specific to them based on how, on the data that we get on their illnesses. Okay? And it's on this that I want to give you a short presentation on the disease trends based on our statistics. We keep data so that it can help us in developing products, on advising our clients, and also how to manage our business. I'm going to take you through, first of all, the top 10 diseases by cost. I think the first one doesn't surprise you. Diseases of the respiratory system, especially with the weather currently. 19% of the bills that we paid in the last 1 year have come from respiratory system. The second one is the disease of the digestive system. Most of them hygiene related. Then infectious and parasitic diseases. Out of this top 10 diseases, we paid 619 million, but I'll take you to the details. And you don't have to take notes. We'll give you a release. We have all this data. We'll provide it to you. Okay. Let's start from the top 5 diseases from children 0 to the age 10. Again, it comes as no surprise that the biggest cost there would be diseases of the respiratory system, at least 50%. Most of the diseases in this age group relate to hygiene and low immunity. That's where you get frequent infections. And in this particular area, we try and encourage adequate breastfeeding and proper nutrition. Personal and environmental hygiene are the measures that will keep these infections at bay in this particular age group. The next one is children between the age of 11 and 20. Although respiratory system diseases are common across the ages, here you find a lot of muscle and bone injuries. Children are most active, they're in school playing sports. When we look at our costs, this is where most of the costs will come from. So we normally recommend proper guiding and counseling in learning institutions where our children go to school, engagement in sports occupational therapy, and then guidance on healthy lifestyle. Because of antisocial issues, we are finding a lot of growth in conditions that have been brought by substance abuse and drugs. The next category is age 21 to 30. Maternity starts coming in here because because of the awareness and need of safe deliveries. And in fact, most of the when you approach this category to sell products to them, maternity is one of the key issues that people will ask for. And interestingly, there are people who will buy a product for maternity. Within 2-3 months they've conceived, and after they deliver they go away. We wish they would stay longer, but the prudent ones stay because they want to ensure their children. So in this area we offer proper guiding and counseling, socio-economic support, health education, because most of these people are employed under the employment age, so we normally engage with them at their employers or places of work. Between the age of 31 and 40, maternity cost, it's very high, but we have now more common cases of complicated pregnancies. The infection rate in this category is lower. Okay. Now, the issues of self-actualizations start being pursued. We are seeing an introduction at this rate of lifestyle diseases, which previously would not have happened, but they're there. So we work a lot on health education, and we have intervention measures that we discuss to mitigate risk factors like family planning, safe sex, and the avoidance of drug abuse. The next category, which has a lot of members, is between the age of 41 and 50, where the aging process starts to set in. Okay, reduction in bone strength, and you find this is the advent of lifestyle conditions, hypertension, and other conditions that are long term. They develop at this age. In this area, we try and recommend proper nutrition and exercises. We try and encourage this group of people to go for annual checkups, and it's where we start doing PSAs. And this is actually the group that you find start advent of cancer. So nutrition is key, and exercise. We have also negotiated with our providers in this particular category so that if people have one condition like diabetes, they can go there for advice, and not only when the condition is debilitating. The next category is 51 to 60. Now you find here communicable diseases are lower, but lifestyle diseases are now quite high. And then you find that when this category falls sick or have an accident, they take longer to heal. So the cost is pretty high. Okay. Now most of these people are in decision making and leadership. So you cannot run an insurance business without having them, because they're the ones who will be making decisions for the corporates that we engage in. And you find, although they are fewer in number, the cost is pretty high. Again, here we encourage proper nutrition and exercise to maintain a healthy lifestyle, and work on them to alleviate and control lifestyle diseases like diabetes, hypertension, and kidney functions. The last one is 61 years and above. You all are aware that resolution, we don't have an upper age limit. So you can join when you're below 65, but you stay with us until as long as you are alive. And you have a lot of members over the age of 61. Again, here, it's the prolonged healing process following an accident or illness. And then the advent of lifestyle diseases. So the observation we see is the transition and adjustment from active work life, where people are going towards retirement, and the conditions that are lifestyle related. Again, we encourage proper nutrition and exercise, social and family support, and just like the other group, we work on efforts to alleviate and control lifestyle conditions like diabetes and hypertension. Sorry. The next list we're giving you is the top 10 diseases for inpatient. Whereas you find diseases of the respiratory system on outpatient, on inpatient, pregnancy, childbirth is the biggest cost. Okay. Then diseases of the digestive system, followed by respiratory tract infections. You'll find that 5% of what we are paying for now is cancer at a big cost. Neoplasms. It's we've seen an increase in this particular category, and I know there's a lot of communication. We've seen cancer centers being set up. We are criticized often by taking these conditions out of Kenya to places like India, where we find treatment is the efficacy is much better and actually quite more affordable. So we try and promote awareness for medical insurance to sensitize the public on personal and environmental hygiene and healthy lifestyles, especially for the older people, to ensure that we can control this particular cost. This cost, the pregnancy cost, really, there's nothing much you can do, because most people who buy it are at a childbearing age. And we are aware that this will continue being a big cost. The last one is diseases for outpatient. Again, no surprise there, 28% is respiratory tract infections, followed by infectious and parasitic diseases. And then third is the diseases of the digestive system. So those are the numbers. And we'll share these numbers with you. We felt we should give you this particular information because it's data that we get. And it's representative, these diseases and this data is representative of people living in urban areas, whether you're insured or not. I thank you very much for listening to me. If you have any questions, and what I can't answer, I have my team to help me.
You haven't mentioned what area was this data taken from? Was it from Kenya only, or from East Africa, or from Africa alone?
Okay. It's from all our clients in East Africa, but Kenya is our biggest market. We only moved to Tanzania a year ago and Uganda this year, so a lot of this data is from Kenya. Any other question? Okay.
Can you hear me from that side? I think I'm loud enough. The only problem I normally have is being too fast. If I go too fast, the beginners mad at me, I'll go slower. Our sales manager has joined us, Robert Onyango. Say hi, you're not here when Peter was doing introductions earlier. He's our head of sales. And we do lots of incentives for our brokers, our agents, the external ones, the internal ones we have. We have lots of different incentives. They go around the world, they win cars, they do different things. This year we sat together and thought, as a business, how can we also incentivize other persons, our members to take cover, our members who are on cover with us to bring their friends and family to join us, and our staff members. So we engaged with the Betting Control and Licensing Board. It was quite a rigorous process. Our team at EXP greatly helped us. This is the first time an insurance company has done such a promotion. We're happy to see other brands in the market, other financial institutions taking up on this process and rewarding their members for recommending them. You are our best brand ambassadors by having joined us. You give us the most important feedback when we go wrong, when we go right, and it's important to reward you. When we look at the insurance penetration figures, and Peter, you can help me with statistics, I'm not sure what we say in penetration. It's at 3%. And a lot of, not just for us, but across all the companies, a lot of cover is bought by corporates and groups. And it's important for us to encourage individuals and families to take medical cover for themselves. And that's the essence of this promotion. We have various aspects towards it, where you just signing up, as some of you here have, take cover and you win. We have you already on cover with us, refer a friend. We said that we also have our own team members as brand ambassadors. We had a separate category for them and a separate prize pool for them. One of these cars is dedicated for our staff, for them to also refer and win. So that's what it is about. It's not over. This is just the halfway mark. So if you are, even you amongst our media friends here who are not on cover with us, join and you can win. So I'd like to call upon Robert Onyango to come and help us award the first set of prizes. And these ones will first start off with awarding our staff members. Robert, you come across here? Luther? Come on stage perhaps. Yeah. You can? Okay. We have 4 staff members who qualified for winning a cash prize of Kenya shillings 10,000. And I'd ask them just to come up all together, and then Robert will do that presentation. We have Scholar Nganga. Congratulations, Scholar. Scholar is a senior client service agent of ours. She's in our underwriting team. She's won 10,000 shillings in cash. Yeah. Give me my paper. Sorry, let's just switch off the projector so the pictures can come out nicely. Congratulations, Scholar. We're waiting for the actual.
Is there a check inside?
Yes.
Huh?
It's cash.
Cash, remove cash.
No.
Congratulations, scholar. Duta Kinuzia, she's in marketing. She also wins 10,000 shillings in cash. Yes, they all referred. They have referred persons who have come and taken cover.
Take your time, take your time.
Yeah. We've gotten a lot more referrals, but the ones who are winning are the ones who the referrals have come through. We also have Kevin Ombuge. He's part of our employee benefits team. Congratulations, Kevin. Congratulations, Kevin. And our last winner, Vidiana Wambogo, congratulations. Vidiana is the executive assistant to our chief operating officer. Congratulations, Vidiana. And the member she brought through was a member who had actually been on cover with us and had lapsed their policy. So we also have a lot of the few that we have lost in the past coming back to renew. Robert, there's one more. The grand prize for the section of staff currently, it goes to Joshua Nyaberi, who has won himself an iPad 4. Congratulations, Joshua. He's in our IT team. Thank you very much for bringing your friends over. Thank you very much, Robert. I'd like to move into the next section, which is for our members. These are either for the members who join us for the first time or have referred a friend. They're both going to be mixed up here. I'd like to welcome Henry. I might be scared to say your surname. We'll let you say it yourself in case I do it wrong. Henry is our IT infrastructure manager. First say your full name so they don't do injustice.
Henry Marquist.
I've said it wrong. Karibu Henry. We have several winners here. I'm not sure if they all will be present. And for this group, they receive hampers. We have a lot of things in the hampers, from resolution gift items. But I'll just go through the list. There's Joyce Ngumba. I don't know if Joyce is present. We've got Esther Kisangao, Amolo Okero, Joyce Kinuzia, Oscar Katambo. I will also make a mention that most of our winners are not all from Nairobi. So also when you're making calls confirming for the attendance here, we had some from other regions. We have Millicent Otieno, Evelyn Kamore, Susan Jogona, Matthews Joroge, and Kanini Mary Waigi. Alrighty, don't worry, just keep standing, keep standing. We also have Owino Norbert, the many prizes. Simon Jogona, Dawn Karao, Wavinya Ndeti, Maureen Manjao, Fidelis Wanjira, Nancy Kipsandui, Tana Herbert, John Matthew, and Abbas Ashi. Here I know we have one of our winners here, Karibu Ann Mutie, and congratulations on your prize winning. We can give her a round of applause. Anne is an existing member of ours, and she referred a friend to come and take cover with us. Congratulations, Anne. I don't know if we have Esther Nyambura, David Mariah, Alan Mugai, or Marston Kamasi present. We have Marston Kamasi. Thank you for joining us. Marston is a new member who's taking cover with us. He also wins a resolution hamper. Karibu. Thank you for joining us. Devan Bisha, Muhammad Ali Omar, Abu Wahab Ali Said, Asli Ibrahim Abbas, and John Kabir Gitahi. Those are all the winners of the hampers. Thank you very much, Henry. We have 3 more categories to go through, just the cash prize winners of our members and the other prizes. I'd like to ask for cash, the money man, Mr. Abraham Muredi, to come and award the cash to our members.